go and I start reviewing the charts, seeing if there's any orders that I'm going to need to start doing. Um, and then like I'll read the H&P, the history and physicals on the patient. And by that time, it's time to get a report. I'll get a report. We'll go to huddle, and then I'll continue to go. I'll go introduce myself to my patients, see if they need anything. And then if they don't need anything, if I don't need to like medicate for pain or, get drinks, food, anything like that for my patients, then I'll go finish reading H&Ps and see what the plan of all my patients are, write down all my orders. And at that time, I start planning out which patient I'm going to see first, who's more critical, who I can hold off on, who's going to take me longer. And then just plan out my patient care from there and my assessments. Of course, there's, changes happen and you would have to sometimes take a different route or you can't stay on that same exact track. But I try to stick to it so I
Okay.
can.
So I hate to interrupt, but it seems like a lot of things you have to do. What's the typical hours or shift that a registered nurse works?
So our shifts say they're 6:45 to 7 p.m., but there's never a time that we leave at 7 p.m. It's always after 7.
Oh,
So usually I work 13 plus hours.
wow. So this is a lot of time on your feet, a lot of time, moving, taking care of patients. So you work about 13 plus hours. About how many days a week normally?
So full time for a nurse is 3 days. I usually work 4 days.
Okay. So for someone who wants to have 3 days of work full time, I guess nursing would definitely be a job that someone would want to look into.
Yes.
Okay. So, and I'm looking at your background. You have a pretty extensive educational background to do what you do. Can you walk me through your education?
Yeah. So I started in a community college. I did all my prereqs. I got an associate science at St. Philip's College. And then my options were to go straight through the BSN course or do an associate's course in nursing. And I chose the associates because I have kids and I wanted to start working right away. And I knew I could just do the BSN online, which was more ideal for me at the time. So after nursing school, I finished in out of May. Um, and then in October, I started my BSN program. And then I finished that about a year, like some months later. And then here coming up in June, I'm going to be starting the mental health nurse practitioner program.
Okay, great. So for the working individual, for the working mom, for the working dad, um, getting that associates in nursing, getting your RN, getting straight to the workforce, and then completing your BSN, your Bachelor of Science in Nursing on your own time online. For you, that was most beneficial, correct?
Yes.
Okay, great. Is there someone who you think would benefit, who wouldn't benefit from completing the BSN online versus in person?
If you don't have time management or sometimes I say like people need family support because I mean there is times that you're tired or if you have kids, you need somebody to watch your kids. You need support to help you get through these programs because a lot of times you can feel like overwhelmed. You're working nonstop, especially somebody who works night shifts like me.
Right.
I work night shift. I sleep during the day, and then you don't have very much time in between or your days off. Your days off are your resting days,
Mhm.
but you're having to sacrifice that time to be able to complete your assignments. So that's where I ran into a lot of my issues. That is sometimes I would have like a day off in between work and me working night shift. I get off of work, I'm wanting to sleep and not do more work or not stay up to complete assignments. But I didn't have that option. Like I knew I need to push through. I knew it was just gonna be temporary and I just had to do it.
It makes
So
sense.
it's hard as working night shift and then doing the work. Day shift, it's a lot more easier But again, I mean, of course, they're still tired. It's just time is more better for that
Right.
option.
Just it's kind of that sacrificing sometimes sleep and sometimes a little bit of family time to get schoolwork done. Short-term pain for long-term gain.
Right.
I trust me, I definitely understand where you're coming from with that one because it's balancing that school, work, family life. Ooh, it's it is a nightmare sometimes. But knowing you didn't start off with just okay, I'm going to go to school and do nursing. You had a previous job or career prior to joining nursing. So tell me about your previous occupation and then what made you think, you know what, I need to go to nursing.
So I thought tech support was what I liked. That's what I joined the military with, the reserves. And then after doing it in the reserves and trying to do it on the outside in the civilian world, I didn't really like it. And then I landed a good customer service position on base for the Navy, and I worked for the Navy PSD. And I loved customer service. And then I had an incident with my brother going into the hospital, and he went to a coma. And being there with and watching the nurses work hands on with my brother, I knew the medical field is where I wanted to go.
Oh,
I didn't know which route I was going to take. I just knew that's what I wanted. Um, so that's when I started my prereqs, and then after my prereqs, I was like, okay, nursing school is where I want to be, and that was my main end goal. And then so I started my prereqs, and I did it for nursing school and what class I need to take for them, and everything just worked out perfectly after that.
okay, great. So we know what got you to the nursing profession. What keeps you energized? What keeps you saying, you know what, I want to continue to do nursing?
Seeing patients who come in and they're not doing well at all. Like we've had stroke patients who come in, they're not talking, they're not walking, they can't eat, they're unresponsive, and getting them to the point where, if their stroke was caught fast enough or before there was any brain damage, then we're able to get them, doing PT with them and get them back to being better.
Right,
It's rewarding seeing your patients get better, patients who come in with even just little pneumonia, and they're barely breathing or they're barely holding on, and but getting them better, or just seeing the family happy with your care, that's what keeps me going. I love patient care, I love bedside nursing. I just love to be with the patients, and it's a rewarding job. You're going in with a purpose.
that's awesome. You seem pretty passionate about the field of nursing. But and we kind of mentioned this earlier, but you do work in a team concept. And I know you mentioned like respiratory therapists and dietitians, but what other professions do you work with on a fairly regular basis?
Yeah, so we have our nurse practitioners who work, mostly nurse practitioners work at night, and then we have a main one doctor. So we have a doctor, then we have two nurse practitioners who work at night with us. Then we have the nurses, then we have a respiratory team, then we have laboratory. Um, then we have our radiology, and we have our CNAs, we have PCAs, we have our unit secretaries, and they all play an important role in the hospital. We all have to work together, or it can't be done. And during COVID is where you really seen it, everybody come together
Makes
and work with each other and get through everything together.
Okay. Seems so that again that team concept. It's the one person can't handle it alone. You need that team to kind of push each other up, especially when you have busy nights or you have hard times.
Right. A
Uh,
team is what you need.
yes, absolutely. So obviously there are things that we learn in school about the profession, and then we have an idea about what it's going to be like, and then we get into the professions and oh, I wish I knew that before I came to the profession. So, what are some things you wish you'd known back in nursing school prior to joining the nursing course?
Basically, it was a lot. When I left nursing school and I started nursing, I'm like, oh, I didn't know anything. So a lot of it is like have how to read orders or how to know how to tell a doctor, like communication. When you don't feel something's right with your patient, you're having to tell the doctor, well, this is what you're having me do, but I don't think that that's the right route. This is what I feel like we should do. And being confident to tell the doctor, being confident what you tell your patient, because if you lack that confidence, they're not going to trust you. So I think, like, being confident, more hands on. If I would have known to be more hands on in nursing school, I was always wanting, just sit back, watch, and observe. But I should have I should have engaged. I wish I would have engaged more. I wish I would have, more working with the computers and how to put in orders, especially under stress. Like when we call a rapid response and we're having to hurry up and put orders in order to scan the patient and do what the doctor wants. You're having to work under a lot of stress. And if you don't know how to do that, or you don't know how to manage your time and you don't know nothing about your patients or, the plan of care, what care they got prior to you, that's hard because they're going to start asking all those questions. So time management was something I should have practiced with nursing school when I did clinicals, but I didn't because, we had one patient that we focused on. We didn't have 6 patients that we had to do all the paperwork on.
Right.
So I was only prepared, just for that one. We didn't start doing 6 patients, 4 patients, 5 patients until the end of nursing school. And that's when we would pass our meds on everybody. But I feel like that should have been started in the beginning. And then it would have been easier, coming on as a nurse.
Oh, wow. So you mentioned a lot in there. So you mentioned, time management. You mentioned assertive communication skills. You mentioned research. You mentioned computer savvy, or at least being competent in certain computer systems, to where you can navigate and be confident in your navigation skills. So you unpacked a lot. So there's a lot of things that you wish you've known, and that will help future nursing students who have an idea, or want to go into nursing. I need to focus on these things in addition to my didactic and clinical skills.
Yes. And a lot of, like, when we're doing preceptorships with nursing students, or even when we have our orientees and we're working with them, I want them to like dive in right away. Like,
Right.
I want you to take over and I'm just going to watch over you and I want to see what you do,
Mhm.
because you have to know how to assess your patient properly. You have to know what to look for. A lot of it is 3 of your patients could come in for pneumonia, but you have to know which route you're going to take with every patient, because never going to be the same patient care. One patient may have hypertension, one patient may have low blood pressure, but you have to know what medications and how you're going to work with both those patients to keep all their body systems going and do the proper care. And what meds are going to work with some patients may not work with other patients, because some patients are, they're obese or they have fluid overload, and you can't do the same things you could do with that patient as you can do with the next patient. So you just have to know how to differentiate your patients. And I mean, it comes with time. You have to work with the patients to know.
Okay, that's definitely good to know, especially with new graduates or people who are wanting to get into the nursing field. Do you have any advice for anybody who wants to enter the field of nursing?
No, but to study. Never to wait till last minute, study one thing and then dump. Everything's gonna start coming together. I know a lot of times I would wait till last minute study and then I didn't retain a lot. So retaining. You need to retain your information. Study your body systems. Take A&P very serious. Don't just take it as, oh, it's a class I need to take and get out of here. You need to know your body systems. You need to know how they work, and you need to know how they work together because it all goes down together. And that's where I feel like I messed up sometimes because I didn't enjoy A&P at the beginning. If I would have known what I knew now, I would have enjoyed it. But maybe I didn't have a good teacher who kept us engaged because I was just trying to hurry up and get through the class. So I didn't retain a lot of information. Whereas if I would have, I felt like I would have known a lot more coming into nursing.
Mm.
But now I was playing catch up my first year of nursing because I'm having to learn the body systems and what they really do and how different illnesses can affect the body. So to take school serious, it's not just something you need to get through and become a nurse. No, you need to retain information, understand what the teachers are doing,
Okay.
ask questions, ask and not to be scared to ask that and not to be scared to engage. Because the more you engage, the more you ask questions, the more you're going to retain.
That makes sense. I know, just from my experience, I've had to take A&P more than once. Not because I failed it, but um, some college courses, some programs only take A&P after a certain amount of years.
Right.
Um,
Like most of
and
7.
and I know that a lot of schools use A&P to weed out the medical students who aren't dedicated. Sometimes they
Mm-hmm.
make it hard on purpose. Uh,
Yes.
but um, but A&P is one of those basic building blocks. If you're going to be in the medical profession, you have to know what right looks like from a particular body system.
Mm-hmm.
So that's definitely good to know. I know some people are professional procrastinators, and it's not a bad thing for in a lot of cases because as long as you get your work done. But as you said before, if you're just learning it just to do a data dump and not retaining it, then that's not going to be useful for you later on in your career. So I guess for the professional procrastinators, if you just do data dumps after you study what you need to know just to pass the class, then that won't serve that particular population well.
Right.
Okay. This has all been very helpful, Sabrina. Is there anything else you'd like to say to the audience before we conclude?
No, not that I can think of.
Okay. All right. Well, I would like to thank you very much. I know you're coming off a shift, and I know you're tired. So I'm going to let you take a nap or take care of household chores. I appreciate your time and attention to talking about the field of nursing, especially being a registered nurse in today's COVID world. So I appreciate you and your and what you do.
Thank you. I
All right.
appreciate